Thinking about getting a dental implant? Before you choose titanium, you need to know the hidden risks that could affect your health for years. Stick with Medical Miracle to uncover the truth about titanium implants and a safer alternative that might just save your smile. Welcome back to Medical Miracle. Today, we're diving into a topic that affects millions of people, replacing missing teeth by dental implants. Specifically, we're uncovering the hidden dangers of titanium dental implants. If you're considering dental implants or just curious about your options, let's get started. Losing a tooth isn't just about aesthetics. It impacts how you chew, speak, and even your overall health. For centuries, humans have been finding ways to replace missing teeth. From ancient times using ivory, bone, or even gold, to George Washington's infamous lead-based dentures, lead. By the time he was president at 57, he had only one tooth left, and his dentures were so uncomfortable he avoided public speeches. Those dentures, stuffed with cotton for his portraits, were a health disaster, likely contributing to his early death. The lesson? Whatever we put in our mouths needs to be biocompatible, something our body accepts without causing harm. It should restore your smile, your chewing power, and not trigger other health issues. So, what are the modern options? Let's break it down. Tooth replacement options. You've got three main options for replacing missing teeth: dentures, dental bridges, and dental implants. But today, we'll explore dental implants option and its pros and cons. Dental implants are the gold standard today. An implant has three parts: the implant itself, which acts like a tooth root and integrates with your jawbone, an abutment or connector, and the crown, the part you see and chew with. Implants preserve bone, restore nearly full chewing power, and look natural. But not all implants are created equal, and that's where things get interesting. Let's take a step back to the 1950s, when a Swedish doctor named Per-Ingvar Bronmark made a game-changing discovery. While studying bone healing in rabbits, he implanted a titanium-encased window to observe blood flow. When he tried to remove it, the titanium had fused to the bone, a phenomenon he called osseointegration. This accidental discovery sparked the development of modern dental implants, as well as hip, knee, and shoulder replacements. Titanium's ability to bond with bone revolutionized dentistry. Unlike dentures or bridges, implants mimic a natural tooth root, stimulating the jawbone to prevent shrinkage. But as amazing as this sounds, titanium implants come with some hidden risks we need to talk about. Titanium implants have been the go-to for decades, and for good reason. They're incredibly durable. Some last 25 years or more, like the one I have right here. Points to mouth, smiles. The bone bonds tightly to titanium, making them rock solid. They've been studied for over 40 years, so we know they work. But here's where it gets concerning. First, titanium can cause issues with your gums. A condition called peri-implantitis, think gum disease but around an implant, can lead to bone loss. If you have uncontrolled gum disease, implants aren't an option until that's managed. Second, there's something called titanium overload. Titanium isn't just in implants, it's in cosmetics, sunscreens, candy coatings like M&Ms, paints, even plastic bags. Our bodies are exposed to it constantly, and for some people, especially women, this can lead to sensitivity. I had a patient once who couldn't wear metal jewelry after getting a titanium implant. Her gums stayed inflamed until we removed it. This isn't a true allergy, those are rare, but an overload where the body says, enough. And here's the big one: conductivity. Titanium is a metal, and metals conduct energy. We're surrounded by electromagnetic frequencies, Wi-Fi, cellular signals, you name it. Studies, especially in orthopedics, show that these frequencies can heat titanium implants by 4 to 5 degrees Fahrenheit. That might not sound like much, but in your jawbone, that heat can contribute to bone loss over time. I'm cautious with my own implant, avoiding keeping my phone near my face and using airplane mode when I can. But in today's world, escaping these frequencies is nearly impossible. So, what's the alternative? Enter zirconia implants. Zirconia, technically zirconium oxide, is a ceramic, not a metal, so it doesn't conduct electricity. That means no heating from Wi-Fi or cellular frequencies. Plus, zirconia is white, so it looks like a natural tooth root, no grayish hue showing through thin gums, which can be an issue with titanium. Zirconia implants integrate with bone just as well as titanium, and gums love them even more, sealing tightly to prevent leakage and reduce the risk of peri-implantitis. Another bonus? We don't have zirconia overload in our environment the way we do with titanium. But there's a catch. Zirconia is pickier about bone health. Titanium can sometimes integrate even in inflamed or infected bone, but zirconia needs a clean, healthy environment. To make it work, we use techniques like ozone to kill bacteria and platelet-rich fibrin, or PRF, from your own blood to boost healing with growth factors in stem cells. When done right, zirconia performs just as well as titanium, with a 97% success rate for both. Oh, and don't fall for the myth that zirconia implants break easily. Older one-piece designs had issues, but modern two-piece zirconia implants are just as strong as titanium. Breakage is rare for both. So which is better, titanium or zirconia? It depends on your situation, but here's why I lean toward zirconia. It checks all the boxes. Biocompatibility. It's non-conductive and less likely to cause sensitivity or systemic issues. Aesthetics. It looks natural, blending seamlessly with your smile. Durability. With proper care, it's as reliable as titanium. And health. It supports gum and bone health without the risks of conductivity or overload. When choosing an implant, make sure your dentist evaluates your bone health and discusses both materials. If you have gum disease or a history of metal sensitivities, zirconia might be the way to go. And always ask about the full implant process, implant, abutment, and crown, to understand what you're getting. That's it for today's deep dive into the hidden dangers of titanium dental implants. At Medical Miracle, we're all about empowering you to make informed health decisions. What do you think, titanium or zirconia? Have you had an implant experience you want to share? Drop it in the comments below. Don't forget to like, subscribe, and hit that bell for more health insights. Until next time, keep smiling and stay healthy.